We're going to be looking at the anatomy of bone. To begin, we'll look at the function of bone. The functions of bone include support. For example, your muscles attach to the skeleton, the bones, and give a framework for your body. Movement, should those same muscles pull on the bones, there's an anchoring point in the ability then to create movement. Bones protect you. For example, your skull protects your brain. Your pelvis protects your reproductive organs if you're a female, or your urinary bladder in some of your urinary organs for both sexes. Additionally, your thoracic cage can protect things like your lungs and your heart. Another function of bone is the formation of blood cells. So white blood cells, red blood cells, and platelets are all going to come from bone. Bone also stores minerals such as calcium. Now we're going to look at the gross anatomy of a bone. By gross, we don't mean disgusting. Rather, we mean this is something that we can see with the unaided eye. So if you take your leg, for example, take the bone out and take a section of it like the picture shows, we would be looking at the gross anatomy of the bone. The first structure is called the diaphysis. The diaphysis is also known as the shaft portion of the bone, so it's the long portion. If you look at the anatomy of this, the outside of the diaphysis is made up of compact bone. As the name implies, we're going to have lots and lots of cells packed into a really small area. In the center of the diaphysis, we have a cavity called the marrow cavity. The marrow cavity contains yellow bone marrow. And then the function, of course, of yellow bone marrow is adipose storage. So we store some fat there and maybe can access that for some additional energy if needed. At each of the ends of the bone, we have a structure called the epiphysis. There would be a distal epiphysis and a proximal epiphysis depending on which of those two was closer or further from the point of attachment. So by definition, the epiphyses are the ends of the bone. They're the irregularly shaped, enlarged ends of the bone. If you look at the cross-section of the epiphysis, you'll see that the very outside is still compact bone, but on the inside we've got something called spongy bone. Inside of that spongy bone, you'll have a bunch of red bone marrow. Red bone marrow's function, again, is the creation of red blood cells and white blood cells and platelets. Now, around the bone, we have a structure called periosteum. Peri refers to around. Osteum is going to be referring to bone. So this is a membrane that you'll see around the outside of the bone. By definition, it's a membrane surrounding the bone that contains bone-forming cells. So should the bone need to thicken, should the bone need to repair itself, the periosteum is where some of those cells will come from. At each of the ends of a long bone, we have structures called articular cartilage. When a bone articulates with another, it comes together and forms a joint. Therefore, articular cartilage is cartilage that's found on the ends of the bone. This is made up of hyaline cartilage. Hyaline cartilage is a flexible yet strong cartilage. It's the most common type of cartilage inside the body. Functionally, the articulating cartilages are going to cushion the joint and reduce friction between adjacent bones. So people who have arthritis have cartilages that have broken down on the ends of their bones, and then they get there's just the epiphysis or the ends of the bones rubbing up against one another, and that creates some friction and pain. If we took a bone, took a section of it, and then mounted it on a slide and looked at it underneath the microscope, we would be studying the histology of the bone. So we're going to take a look at the cellular level, how bone is arranged. Compact bone is the first that we'll start with. Compact bone is made up of structures called osteons, or sometimes they're called haversian systems depending on which text you're reading. Osteons are the functional unit of bone, and it's a circular pattern in which bone arranges its cells. The cells then that we have inside of compact bone are called osteocytes. Again, if we break that word down, osteo refers to bone and cyte refers to cell. So these are simply bone cells. Now, bone is a solid tissue. And if we've got a living cell inside of that solid tissue, there has to be a space in which that cell sits. The space is called a lacuna. So it's the space in which an osteocyte sits in bone. I like to use the example of Jell-O and fruit in it. So if you take and make some Jell-O and stick some fruit in it, let's say that the matrix or the connective tissue portion of the bone would be the Jell-O. The cells or the osteocytes would be represented by the fruit. In the event that you saw, that one maraschino cherry that you wanted inside of the Jell-O and you stuck your fingers in, grabbed the cherry and pulled it out, you would have effectively taken out an osteocyte. The space that would be left in your Jell-O then would have been the lacuna. Another structure that you're going to see inside of bone is something called canaliculi. Canaliculi is cellular extensions that come out from adjacent osteocytes. Again, since the connective tissue of bone is solid, there's got to be a way for the cells that are alive to get materials in, so raw materials for metabolism, and also get their waste products out. They do so via the canaliculi. So by definition, canaliculi are cellular extensions that connect adjacent lacuna. And again, they function in communication. So being able to communicate with adjacent cells and, more importantly, getting nutrients in and waste products out. Additionally, you'll see in an osteon something called a central canal. So again, osteons arrange themselves in circles. And if you were to look in the very center of an osteon, there's a hole called the central canal. This is a passageway for blood vessels and nerves. So I've been mentioning that the osteocytes get their nutrient via the canaliculi. They get the nutrient, of course, from the bloodstream, and that's traveling inside the central canal. So we're going to use diffusion in this case. Okay, taking a look at this picture, at the top we've taken a piece of compact bone and taken a section of it. You can see that the circular pattern that's kind of telescoped out at the top, that would be one osteon, and it has a central canal in the center. If you look down a little bit further, you can see that they've taken some cross sections of those same osteons. So inside of that central canal, you can see the blood vessels running up and down. That would be the red and the blue structure, and then the yellow would be the nerve inside of there. Each of the little dots that you can see represents an osteocyte. The space, again, that it sits in is the lacuna, and the little cellular extensions that almost look like spider legs coming out from each of the osteocytes would be the canaliculi. So they've gone ahead and they've blown up one osteocyte at the bottom of the screen. So you can see the cell, and the little bit of white space around the cell represents the lacuna, or the space that it's sitting in. And again, the little cellular extensions that are coming off of that osteocyte would represent the canaliculi. This picture represents what you would actually see underneath the microscope. Again, the big circular pattern that you see is an osteon. Each of the dark dots would be an osteocyte. You can see the canaliculi really well in this picture. There are all the little lines running out from the osteocytes. And then in the center of each of the osteons, again, you'll see the central canal, which would contain the blood vessels and nerves. The other type of bone that we'll look at is something called spongy bone, and sometimes it's called cancellous bone, depending on which text you're reading. Spongy bone is made up of a bunch of structures called trabeculae. Trabeculae are basically bony spicules that are running in a bunch of different directions, forming a network that looks much like a sponge, which is where the name comes from. So again, the trabeculae are simply bony spicules. All right, so here's the first question. What is it that holds bones together? If you guessed ligaments, you were correct. All right, now taking a look at this picture again off to the right, you can see where the compact bone and the osteons stop and the trabeculae or spongy bone continues. So spongy bone is not a solid bone, rather it literally makes up the shape of a sponge. Cartilage also plays a role in the skeletal system. The first type of cartilage is hyaline cartilage. Hyaline cartilage is very, very common inside of the body. It's going to be the most common type of cartilage that you'll find. functions mostly in support. You can find hyaline cartilage in places like your costal cartilages. That would be the cartilage that attaches, say, the ribs to your sternum. You can find it in your articulating cartilages or at the ends of your long bones. The other place that I have up here that you can find it would be at the tip of your nose. So it's a strong type of cartilage, but it still allows for some movement. The next type of cartilage is called elastic cartilage. And as the name implies, elastic cartilage is not only good at stretching, but also recoiling after that stretch. It's a very, very flexible type of cartilage. Places in your body where you can find elastic cartilages are going to be the ear. So if you take your ear, you can literally just bend it right over. So you'd have elastic cartilages in your ear and in your epiglottis. Your epiglottis is that little flap of tissue on the top of your trachea, that's your windpipe, so that when you go ahead and swallow your food or water down, you don't aspire your food down into your lungs. The last type of cartilage is called fibrocartilage. As the name implies, there's lots and lots of fibers inside of fibrocartilage. It's a really dense type of cartilage and it's very, very strong. So it's going to be the strongest type of cartilage that you'll find inside the body. You can find fibrocartilage in places like the meniscus. The meniscus you can find inside of your knee. You can also find a meniscus, say, in your jaw. The other place that you can find fibrocartilage is in the pubic symphysis. If you're unfamiliar with where the pubic symphysis is, it's between your two pubic bones. It's going to be a really strong piece of cartilage that kind of allows for a little bit of movement between your two hip bones as you walk throughout your day.